STELLA, BULUMA. I am a clinical officer by profession, and I have 14 years of clinical practice or clinical experience. I work with Masinde Muliro University of Science and Technology at the Health Service Department, but I'm also a part-time lecturer in the Department of HPE, that is Health Professional Education, teaching clinical officers. I have got experience in medical practice as well as the management of HIV in our institution, because we work in conjunction with the HIV or the AIDS control unit. And in this particular department, we are concerned with HIV testing and counseling, management of HIV AIDS infection, and also preventions of mother-to-child transmission of HIV. This disease, that is HIV AIDS, and it is human because it is the virus that actually affects only humans. It cannot affect animals, that's why it's referred to as human. And it is immunodeficiency because it affects the immune system. There are specific cells of our immune bodies that are affected. And so once they are affected, they become deficient or they become less, and so we say it is immunodeficiency. And of course, the virus itself is, as I have said, it's a virus that affects the human body. That is the meaning of HIV itself. And so it is also important for us to understand that once the HIV is not managed properly, it progresses to AIDS. And AIDS actually means acquired immune deficiency syndrome. It is acquired because you get it. It is immune because it affects our immune system. It is deficient because it causes some deficiency in our immunity, and is a syndrome because it's a collective of some illnesses that mimic some signs or some symptoms together, and so it becomes syndromic in nature, and that's why it's called AIDS. So if you don't manage the AIDS itself, it will progress. If you don't manage the HIV disease or infection, it will progress to AIDS itself. Now, for you to contract HIV virus, it means it has some of its own roots, because you don't take water for you to get HIV and AIDS. No. The most important route of transmission of HIV AIDS is through unprotected sexual intercourse. For you to contract HIV AIDS, it has got its own stages. So you have stages of HIV. And it is these stages of HIV that help healthcare providers to manage the disease itself. So the first stage of HIV is the fact that the virus itself, the virus is a cell, and this cell has to attach itself into the host cell, and that is the human cell. Remember we said HIV is human immunodeficiency syndrome. So the cell, which is gotten from somebody or somewhere, has to attach itself into the human host cell. Now, what makes it to attach itself into the human cell are specific receptors. No wonder the name human immunodeficiency virus, because it cannot attach into the animal cell. It only attaches into the human cell. So once it attaches into the human cell, it has got its own specific receptors. It attracts, the receptors within that cell attract and attach to the receptors of the human cell. Remember, the human cell or any other cell has got specific parts. And so the outside membrane or the outside covering of that cell has got specific receptors that enables or allows this HIV virus or the cell of the HIV virus to attach into the host cell. So once it attaches, there is some reaction that takes place, and when that reaction takes place, it allows the virus, the cell of the virus, to enter into the host cell. Now that is stage one. It must attach, it must bind into the host cell, and once it binds into the host cell, there is a chemical reaction that will take place, and that reaction will allow that virus to enter into the host cell, that is the human cell. That is now stage 2. Once it reaches into the human cell, remember, HIV virus is a ribonucleic virus, and the cell contains what we call the DNA, that is the deoxyribonucleic acid. This the DNA, or the deoxyribonucleic acid, is a double-stranded structure, and the RNA, or the ribonucleic acid, is a single-stranded structure. So there are things that are going to happen because these are two different things. The virus is RNA and the host cell is DNA. So this virus has to mimic the structure of the host cell. So what happens is that there is what we call reverse transcription, whereby the RNA of the virus will be converted into the DNA of the host, or of the human, by the help of an enzyme called reverse transcriptase. So you must have that enzyme to convert the RNA of the virus into the DNA so that it resembles the DNA of the host, and once it resembles the DNA of the host, it's now called the pro-DNA virus. Then, after getting into that cell, within the nucleus, what happens is that it has to convert itself. It mimics the structure of the real DNA of a human being. So that mimicking structure is by the help of the reverse transcriptase enzyme. So once it gets the reverse transcriptase enzyme, this RNA is being converted into the DNA, and once it's converted into the DNA, we now call it a provirus DNA. So we have got the DNA of a human being, and we have got the DNA of the virus within the nucleus of the human. So once it forms the provirus of the DNA, or once it forms the provirus DNA, the normal now process of forming proteins now takes place. Remember, this is something that has camouflaged. It is now the DNA itself. So the process of producing now proteins will now start taking place. And so within the nucleus of the human being, we'll have a lot of these pro-DNA viruses. And therefore, that place becomes like a factory, because that is where now a lot of proteins will be produced in the name of the RNA. So what happens now is the DNA, the provirus DNA, will now start, or will now be transformed into the RNA itself in the process of now transcription. So this is where we have what we call production of more proteins, and because you're producing more proteins, that means we have got a very important enzyme there, that is a messenger RNA. The enzyme will convert the provirus DNA into the messenger RNA. The messenger RNA is just like a message, just from the word a messenger, sending information from one place to another. So this messenger RNA will send the information, and it will start copying some proteins, some basic building blocks from the same provirus DNA. So after copying the viruses, or the basic structures from this provirus DNA, you'll now get a lot of proteins being produced, a lot of viruses being produced, because it is being signaled, the cell is being signaled, now we want this number of proteins. So instead of producing the real proteins, it just produces the proteins that contain what? The virus. So you'll have a lot of virus that are being produced within the the DNA. And once they are produced within the DNA, remember, they'll be circulated in the cytoplasm, and through the outside the cell membrane, they'll circulate all over the body. Now, remember, this virus, because now it is an immune deficiency virus, it attacks specific white blood cells in the body. And so it affects the CD4 cells. These are the T lymphocytes. It can also affect some cells within the brain. We call them the glial cells, and even some Langerhans cells. But because it attacks the CD4, the specific CD4 cells, and these CD4 cells are responsible for protecting us against the viral infection. So wherever the CD4 cells are attacked, because we have got a lot of protein, the virus that are being produced, and when they overwhelm the CD4 cells, which protect us, you find that the viral load increases, whereas the immunity now is being lowered. That is why we call it, that is why now it is referred immunodeficiency. Now, whenever there is excess of immunodeficiency, now it progresses to what we call AIDS. So you will now have what we call acquired, because this virus is within your DNA. It has mimicked your DNA. It is being produced because the DNA is the building block. It is the one that is necessary for the production of proteins in our body. And remember, our proteins do a lot of work. They are structural components of our body. They do everything. They build our body. And so because they are produced, what happens is that by the end of the day, you will have a lot of proteins, or there are a lot of RNA, and this RNA contain what we call the virus itself. The virus is within that RNA. So you cannot do away with it. You are born with it, you live with it for long, and you cannot say that I am taking this drug to stop the multiplication or the replication of this DNA or the RNA. Because once you have the provirus DNA, what we call replication is just coming up with more and more and more of other RNAs that have got the same structures. So that's why I began by saying, once in the host DNA or once in the host nucleus, that host nucleus now becomes a factory. So you'll keep on replicating. You give the same things, same similarities, same characteristics as much as you can, because the cell has been signaled to do it. So you'll have it forever. And that's why it has become so difficult for scientists, for the medical fraternity, to find the medicine to control the production of the virus, because the virus is in your DNA and it becomes difficult for us to manage or to treat it. And once you get this virus, you will have some stages. You will have the staging itself. For example, once you are infected, the first stage of infection is stage 1. During stage 1, you become very asymptomatic. You're just like any other person. You are very normal. You have the virus within you, but you're not showing any signs of infection. That is asymptomatic. You are very healthy. But once in stage 2, you are the virus and you start showing some signs, some symptoms. For example, you start coughing, you have recurrent or frequent upper respiratory tract infection. You have got some coughs, sore throat, fever comes in, skin rashes are all over your body, and that's why we say you're in stage 2 and you become a little bit symptomatic. Of course, you will have what we call generalized lymphadenopathy. The lymph nodes will be enlarged all over. So within that stage, we can actually say that you are symptomatic, and so you are in stage 2. But once detected early, we can protect you, or we can prevent a patient from progressing from stage 2 to stage 3. And so once you get to stage 3, the severity of illness also worsens. The severity of the symptoms worsen. you'll find that you will have severe oral candidiasis. And this candidiasis will be all the way throughout your GIT, the GIT system. It can affect your oral, the mouth, the trachea, not the trachea, the esophagus. That is, you will have esophageal candidiasis. It can affect all over until to the anal region. So it becomes a little bit difficult. That is why these patients who are in stage 3 with oral candidiasis or with candidial infections, it becomes a little bit difficult for them to absorb some food, because in the mouth you have got ulcers, you cannot eat food. Within the intestines, they are inflamed, there is no absorption of food, and so malnutrition easily sets in, and there is loss of appetite for most of these patients. And of course, when you come to stage 4, this is where we have got the big diseases that signify, or that actually justify that actually you are in stage 4. You have a lot of cancers coming in. You have got something like Kaposi sarcoma, skin infection, Kaposi sarcoma coming in. It can even affect your central nervous system, and you have meningitis, cryptococcal meningitis coming in, and so many things.